Hi, this is Dr. Welch. The course is OTC 2, and this is Orlistat for weight loss.
So today we're focusing on Orlistat 60 milligrams. That's the over-the-counter non-prescription dose under the brand name Ally. It's indicated for weight loss in adults 18 years of age or older who are overweight when used in conjunction with a reduced calorie and low-fat diet.
When you eat, enzymes in your intestines break down fats, carbohydrates, and proteins. Fat calories are then stored in the body to be used as energy. When you eat more calories than you need, you hold on to this extra fat, resulting in weight gain. Ally promotes weight loss by attaching to the enzymes that break down fat, preventing up to a quarter of the fat consumed from being digested. Because
So you can see Orlistat works by inhibiting those intestinal lipases, and what that does is it prevents the triglycerides that you consume from being absorbed into the body. And that then means that they get passed into the bowels. So when you look at adverse effects, it's kind of tied directly into the mechanism. If you're preventing these triglycerides, these fat molecules from being absorbed, there's only one place they could go, and that's that you defecate them out. And some of the side effects that you notice would be pain and discomfort due to that. And up to 41% of people notice that. So it can be problematic for some folks. But you also notice this urgency to defecate, and maybe accompanied with flatulence or steatorrhea or that fatty stools. And we see that rate to be higher in the first year that you're taking it. So for example, urgency, you may see it up to 38% of cases in year one, but it drops significantly down to only about 3% in year two. Similar for the flatulence and steatorrhea. It's higher in the first year, and it drops oftentimes to less than 5% of the population who take Orlistat after subsequent years. Oily discharge is another side effect, and that can lead to staining, spotting of undergarments, and it can occur up to 12% of the time. So if you think of Orlistat, and we know that it prevents the absorption of fats, okay? And what does that mean? Well, if you don't want those fats to be passed through the bowels because of the potential for adverse effects associated with that, then one thing you could do is minimize those bowel changes by consuming a low-fat diet. Now, consuming a low-fat diet is obviously going to have positive effects if weight loss is one of your goals. Low-fat diet, fewer calories, you're going to lose weight. And what they found with the over-the-counter dose is that for every 5 pounds of weight loss that you achieve through diet alone, reduced calorie, low-fat diet, Orlistat can help you achieve an additional 2 to 3 pounds of weight loss. So it's an added benefit to the lifestyle modifications that you're already doing. It's not a miracle drug that you can just pass the weight and lower the weight by just simply taking Orlistat. You have to use it with dietary modifications. As I mentioned, it's 60 milligrams 3 times a day, and you take it within 1 hour of the meal, and the idea is that it's there in your system ready to prevent the fat absorption. And as I mentioned, it's a reduced calorie and low fat diet. So we know that Orlistat reduces the absorption of fats, but it also reduces the absorption of those fat-soluble vitamins. Those fat-soluble vitamins, as we know, are vitamin A, vitamin D, vitamin E, and vitamin K. So when patients are taking Orlistat, it's important for you as a pharmacist to also recommend taking a multivitamin to help replenish those fat-soluble vitamins that may otherwise not be absorbed quite as well in the body. So then the question becomes, when should the patient take it in relation to the Orlistat? And the answer is that if you're taking Orlistat and it's reducing the absorption, taking the multivitamin at the same time, the Orlistat may reduce the absorption of the multivitamin as well. So you want to space it out as far as possible. And it's actually recommended on the labeling that Orlistat and a multivitamin be spaced out by at least 2 hours in the day. So we know that we're taking Orlistat 60 milligrams with each meal within an hour of the meal. We have to take the multivitamin spaced out as far away as possible. So perhaps at night or in the morning, but as long as it's at least 2 hours away from the Orlistat, let the Orlistat do its thing and then take the vitamins so that the absorption is not impaired. Other interactions, warfarin and Orlistat. If you're taking warfarin, you run an increased risk of bleeding. And the way to help with that is you need to notify the person managing, the provider that's managing the warfarin, and try to adjust your warfarin dose given the Orlistat. So just something that with continued monitoring and dose adjustments, you should be able to handle and prevent those risks for bleeding. Another interaction is with levothyroxine. Reduce the efficacy of that thyroid medication. So again, through lab work and determining your blood values, you can determine if you need to adjust the dose of the levothyroxine while taking Orlistat. I want to share a couple studies. They are actually Cochrane reviews. One of them looked at blood pressure reduction. So we know that if you lose weight, that it can also have positive effects on your blood pressure. And that's what this Cochrane study found in 2016, that the systolic, or the upper number on your blood pressure, reduced 2.5 millimeters of mercury, and the diastolic decreased by nearly 2. They also looked at different Cochrane review, a little bit older study, looked at Orlistat use over 1 year. And they found that there's a 2.9 kilogram reduction in versus placebo. So how much is that? Well, just a quick review, 2.9 kilograms. We know that 1 kilogram is equal to 2.2 pounds. So the kilograms on top of the line and on the bottom of the line will cancel out. 2.9 times 2.2 equals 6.38 pounds. So a quick little conversion from kilograms to pounds for you there as a review. We know that this Cochrane review showed a mean reduction in weight versus placebo of 6.38 pounds. Now it's important to know in these two studies, most of the studies that the Cochrane review looked at, most of those trials were looking at the 120 milligram dose, the prescription dose. So those results may not be seen necessarily at the 60 milligram over-the-counter dose. So that was Orlistat. Thanks for listening.